About 3 minutes to 9:30, the time allocated for the commencement of the House business at the Senate on this 13th day of November, the year 2024. This is the morning Wednesday sitting, and it is a live broadcast that is streaming from the Parliament buildings in Nairobi, a broadcast that is brought to you by the Parliamentary Broadcasting Unit in partnership with the Kenya Broadcasting Corporation. Good morning, my name is Kamche Menza. Being a Wednesday morning, the business that is set to be transacted on the floor of the Senate chambers is responses to questions by cabinet secretaries, and this is pursuant to provisions of the House Standing Order 51C, where a senator shall ask his or her question on a day that is scheduled in the order paper. In the order paper today, we have a number of senators who will be opposing their questions to the cabinet secretaries. Just before I take a look at the questions that the senators will be asking the cabinet secretaries, we need to find out how many cabinet secretaries are expected to appear. We have the Cabinet Secretary for Health, Deborah Mulongo, who has confirmed to attend this sitting and respond to those questions. We also have the Cabinet Secretary for Tourism and Wildlife, Rebecca Miano. And we also have the Cabinet Secretary for Health, the Cabinet Secretary for Wildlife and Tourism. Well, those two cabinet secretaries are this morning expected to appear before the Senate chambers to respond to various questions that have been forwarded to them by various senators or members of the Senate. The Cabinet Secretary for Tourism and Wildlife will be responding to a question by the Senator for West Pokot, Honorable Julius Murgor. This is with regards to the number of tourists who have visited Nasolot Game Reserve from January 2019 to date. And the member will be requiring the Cabinet Secretary to state those numbers of those who also resided within and outside the reserve. Also, the Cabinet Secretary for Tourism and Wildlife, with regards to the same questions from the Honorable Senator Julius Murgor, is to provide details of the revenues collected from that particular game reserve, that is Nasolot Game Reserve, from January 2019 to date, and also indicate the amount that was remitted to the county government of West Pokot. And of course, this will be with regards to the county-owned source of revenue collection, if there is any amount that would have been added to the county's kitty. Also, with regards to the residents of West Pokot who have been employed in the game reserve, and whether the Cabinet Secretary could say the corporate social responsibility activities that have been undertaken by the reserve and indicate whether there are any plans to enhance those activities. That is, once she states those activities, then the senator will be seeking to understand whether there are any plans to enhance those activities. The Cabinet Secretary for Health, Deborah Mulongo, who has already confirmed to appear. Remember, there have been cases where cabinet secretaries are invited to the Senate chambers, but then cancel either earlier or maybe much later. But of course, we understand that the Cabinet Secretary for Health, Deborah Mulongo, has already confirmed her attendance for this particular session, and she will be responding to various questions. There are a number of questions here that the Cabinet Secretary will be responding to, matters regarding health. The nominated Senator George Mbugwa will be asking the Cabinet Secretary for Health to disclose any details on the agreement between Kenya and Cuba concerning the exchange program for doctors, providing a breakdown of the cost. That is the Deputy Speaker of the Senate, Honorable Kathuri Murungi, already in the chambers. Allow me to hand you over to this live broadcast brought to you by PBU in partnership with KBC. Good morning.
Let's pray. Almighty God, We beseech you to be endued with abundant favor and blessings as your servants whom you have been pleased to call to leadership positions in this republic. We sing guidance to treat and consider all matters that shall come under deliberation in so just and faithful manner as to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our church. Amen.
Good morning.
Morning, Mr. Do we have quorum, clerk? Kindly ring the quorum bell for 10 minutes.
The prayer has been said, the chair has been taken, but the House has not quorated to the number that will enable the House to commence its business. So the quorum bell is on for the members of the Senate to be able to make their way into the chambers to allow the House achieve that required numbers. Pursuant to the House Standing Order 39 and 40 are the commencement of the House business. There shall be at least 15 members inside the chambers seated and ready for the business to be transacted for that particular sitting. If the prayer is said and the chair is taken and that quorum is not present, then that will necessitate that particular quorum bell. So that is what is currently happening. We are monitoring the numbers of the senators. Once that number is achieved, the quorum is achieved, then we shall be handing you over back to the proceedings of the House this morning. But as you all know, is that Wednesday morning is a day allocated for the responses to questions raised by various senators. These concerns could be related to matters of county, inter-county, national, regional, or even international concerns. And the questions are normally forwarded to the cabinet secretaries beforehand. So as they appear before the Senate chambers, they already have responses to these questions. But of course, they are usually, as is the norm, we have the supplementary questions. But of course, even those questions have to be linked to the earlier questions or the primary questions that have been asked by the various senators. So the nominated Senator, George Mbugwa, has questioned to the Cabinet Secretary for Health, Deborah Mulongo, with regards to the agreement between Kenya and Cuba concerning exchange program for doctors, and will be requiring the Cabinet Secretary to provide a breakdown of the costs incurred by the government of Kenya in the executing of the said program. The nominated Senator, Honorable Peris Tobiko, will be seeking the Cabinet Secretary for Health to respond to concerns over what happened to the Linda Mama initiative. This is an initiative which sought to achieve universal access to maternal and child health services. It is no longer there, and the Cabinet Secretary will be responding to this particular concern on the Linda Mama initiative. Also, the Cabinet Secretary will be responding to an issue here concerning the government move to discontinue the Eduafia insurance scheme, leaving poor and vulnerable students in public secondary schools without medical cover, as well as concerns on the National Health Insurance Fund, commonly referred to as NHIF, whether there are any members of the National health insurance fund able to access services in all public and private medical facilities? And if not, could the Cabinet Secretary explain the reasons for the same? The Senator for Uasin Gishu County, Honorable Jackson Mandago, will be seeking to understand from the Cabinet Secretary for Health, Deborah Mulongo, on the current shortage of childhood vaccines in the country. That is an issue that has been raised, and the Honorable Senator will be seeking to have the Cabinet Secretary explain the current shortage of childhood vaccines in the country and provide a breakdown of the amount of each vaccine currently in stock vis-a-vis the demand. If you're just joining us, is that the Senate is about to commence its business. However, the House has not quorated. At least 15 members are needed at the commencement of the House business as provided for in the House Standing Order. Those are the rules that govern the House, and it is a House of rules, therefore should be abide by the rules. So we are waiting for the members to be able to make their way into the chambers to attend this particular sitting and transact the business that is lined up for consideration in today's morning sitting. The Deputy Speaker is already inside the chamber, and we are waiting for the members to be able to get into the chamber. If the quorum bell is on, then that means the House does not have at least 15 members, because as per the standing orders, then at least 15 should be inside the chambers for the House to be deemed to have achieved a quorum that would enable it to commence its business. The Senator for Uasin Gishu County, with regards to questions regarding the vaccine, the shortage of childhood vaccine, will also want to understand from the Cabinet Secretary for Health on the steps the government has taken to prevent emergence of preventable childhood diseases such as measles, that is with regards to in light of the shortage of those childhood vaccines. The Senator for Machakos County, Honorable Agnes Kavindu, also has a questions for the Cabinet Secretary for Health, Deborah Mulongo, and this is with regards to whether the ministry could consider conducting medical assessment on the surviving Kenyan victims of the 1998 bombing of the United States of America Embassy in Nairobi, and the rolling out of a special program to enable the victims get subsidized treatment in health facilities across the country. I can see the Senator for Marsabit, Senator Chute, Senator Murango, and Senator Wambua at the dispatch there. Remember, there is a shortage of quorum inside the House, or a shortage of members inside the House. So that is what we are waiting. Once that quorum is achieved, we will, without any further delay, hand you over to the business for this morning's sitting. The Cabinet Secretary for Health, Deborah Mulongo, has confirmed that she will avail herself for this particular session, this particular sitting, to respond to the various concerns that members of the Senate have forwarded to her ministry, concerns surrounding areas of health for the Kenyans. Majority Chief Whip, Honorable Bonnie Halwale, who is also the Senator for Kakamega, has just made his way into the chambers. We can also see the Senator Fatuma Dulo from Isiolo County. The quorum bell is for 10 minutes. That is also Honorable Wakili Hilary Sigei, also in the chambers. Esther Okenyuri, they are having a tete-a-tete with the Majority Chief Whip. The question to the Cabinet Secretary for Tourism and Wildlife will be asked by the West Pokot Senator Julius Murgor, whom we have just seen him. He has already taken his seat inside the chambers. The questions for the Cabinet Secretary for Health also will be coming from the nominated Senator, Honorable Joyce Korir. This is with regards to initiatives to enhance the capacity of the Kenya healthcare systems to provide specialized treatment for endometriosis. This question will be seeking the Cabinet Secretary to outline if there are any initiatives to enhance that capacity with regards to specialized treatment for endometriosis. Also, what steps the ministry has taken to raise awareness of the disease or a condition among primary health care providers and the general public, and to address stigmatization of period pain and other symptoms of the disease. The nominated Senator, Honorable Hamida Kibwana, also has questions for the Cabinet Secretary for Health. Remember, as provided for in the standing orders, if the quorum is not achieved once 10 minutes lapses for the quorum bell, that is the clerk of the Senate checking on the numbers of the senators inside the chambers. If achieved, I will hand you over back to those proceedings. I'm just trying to see whether that quorum has been achieved, but it looks like it has not been achieved yet. If that quorum is not achieved as provided for in the House Standing Order.
Quorum bell again for 10 minutes. Sergeant at Arms.
A further 5 minutes. Quorum bell, the 10-minute quorum bell has lapsed. 5 more minutes for the members to make their way to the chambers. At the lapse of the 10 minutes, if there's no quorum, there is a further 5 minutes as has been directed by the Speaker. If at the lapse of those minutes, there is still no quorum present, the Speaker shall adjourn the Senate forthwith to the next sitting. So we are counting down to the 5 minutes as directed, hoping that the members will be able to attend that particular quorum. Remember, the business that is set to be transacted this morning is to engage the Cabinet Secretary for Health, Deborah Mulongo, to respond to various concerns that regard her ministry. The nominated Senator, Honorable Hamida Kibwana, has some questions for the Cabinet Secretary for Health. This is with regards to the medical interns, whether they have been paid their monthly stipend up to date. Also, whether the Cabinet Secretary could explain the delay and state whether or when the government will streamline the process to guarantee timely payment to the medical interns. Also, the nominated Senator Hamida Kibwana would want to understand from the Cabinet Secretary what the ministry is doing to improve the working conditions for medical interns who currently handle heavy workloads and work for extremely long hours under intense psychological pressure. And also whether the Cabinet Secretary could provide an overview of the support systems and programs currently being implemented by government to address the physical and mental well-being of medical interns. The Senate is still waiting to attain the required quorum for the House to commence the business. At least 15 members should be seated inside the chambers, or the House at least should have at least 15 members for the House to be deemed to have quorated. That is the Senator for Uasin Gishu, Honorable Jackson Mandago. If that quorum is not present, that will necessitate the quorum bell for the members to make their way into the chambers. And if that quorum is not achieved, the House risks adjournment, or the sitting risks adjournment until forthwith, that is the next sitting, which is this Wednesday afternoon. We are hoping that the quorum will be achieved, having in mind that the business that is to be transacted this afternoon is to engage the cabinet secretaries. The cabinet secretary for health has already confirmed that she will avail herself for this particular engagement. Of course, the speaker will also confirm whether she is available or not, or maybe has sent last-minute apologies. But back to the questions. Let's listen in. Okay, we shall go back to the questions that the Cabinet Secretary for Health will be responding to. Once the House attains that quorum, or if there are any indications of the Speaker addressing the House, then we shall be immediately listening to the direction that the Speaker will be giving to the members. The Speaker engaging the Majority Chief Whip perhaps could be with regards to the lack of the quorum inside the House. At this point, the Majority Whip normally whips the members who may be within the precincts of Parliament but yet to make their way into the chambers to do just that, so that the House can commence and continue with its business that has been lined up for transaction in this morning's sitting. Senator Catherine Muma will be seeking to understand from the Cabinet Secretary for Health whether there are any details on the availability and affordability of life-supporting prescription drugs for persons with disabilities and persons living with seizure-related ailments such as epilepsy. In the same breath, the Senator Catherine Muma will also want to understand from the Cabinet Secretary whether there are any pharmaceutical manufacturers, suppliers, and distributors who are partnering with the Ministry of Health and the Kenya Medical Supplies Authority, that is KEMSA, to ensure the availability of these medicines and what the terms are of their operations. The Senator for Kisumu County, Professor Tom Ojenda, will want the Cabinet Secretary to explain the terms of engagement between personnel from the Ministry of Interior and National Administration and the Ministry of Health in the ongoing registration of Kenyans to the Social Health Authority, commonly referred to as SHA. Whether there are any specific roles of the personnel in the registration process. Well, allow me to hand you over to the broadcast. Seems like we have attained that particular quorum for the business to commence.
We have quorum, honorable senators. Okay. So clerk, call out the first order.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages.
Next order.
Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Order, senators. Order. This morning, we expected 2 CSs, the CS for health and CS for tourism and on drive. I've just been informed that a letter has come from the CS Health this morning, requesting for postponement of appearance before the Senate. And they have given a reason that the CS is indisposed and she is not able to appear until a later date. Number two, there was also a request from the Ministry, the CS Tourism and On Drive, whose matter was discussed yesterday at the SBC, Senate Business Committee, and the Senate Business Committee within their wisdom declined to give that amnesty or to give the CS permission not to attend to answer the questions. So the SBC, through the clerk's office, wrote back to the CS On Drive, Tourism and On Drive, that she must appear before the Senate this morning. So we are faced in a situation that none of the CSs will be appearing before the Senate this morning. And it is very regrettable indeed because, you know, honorable senators, we sacrifice a lot. We sacrifice to come to this chamber. So those reasons given to me are not satisfactory completely. So I want to give one or two senators also to wade in into this matter. Senator Chute Mohammed.
Thank you very much, Honorable Speaker. Honorable Speaker, I think now it has become a trend for the CSS not to appear before this Honorable House. Honorable Speaker, if, let's say, for example, the CS for Health, she is supposed to communicate to us 24 hours before. If she has sent the letter today, Honorable Speaker, that means she doesn't care. And this is a trend that has been going on and on and on. And we've said many times, Honorable Speaker, you can remember, we've said if they have an issue, the only issue that can allow them not to come before this House is if they have a cabinet meeting. And I want this House, if they will agree with me, this trend of ignoring this House must stop, Honorable Speaker. Honorable Speaker, some time back, we even suggested censure motions. And today, as I stand here, I want to ask this House to institute a motion, a censure motion, against these two CSS. Honorable Speaker, if you look at the issue of wildlife, people, billions of money are out there with Kenya Wildlife Services that has not been paid up to today. So, Honorable Speaker, when a member poses a question for a CS, it is the responsibility of that CS to come before this House and answer those questions, Honorable Speaker. And if we keep on agreeing to the excuses, Honorable Speaker, then we are going to fail this country, Honorable Speaker. We are elected members, and even nominated members who are here. We are representing over 60 million people in this country, Honorable Speaker. And if a question is asked by a distinguished member of this House, is asking this question on behalf of 60 million Kenyans, Honorable Speaker. And if a CS in this government will ignore requests from this House, I think it is time we make a decision, Honorable Speaker. We start with a censure motion. Thank you very much, Honorable Speaker.
Senator Wabua Enoch.
I thank you, Mr. Speaker. We have said before that we don't want to turn ourselves into a house of lamentations, especially when dealing with wayward cabinet secretaries who have continued to show utter disrespect to the authority of this House. Mr. Speaker, for the CS in charge of matters health to communicate to your office this morning that she will not be appearing before the Senate when she is expected to be here at 10. Speaker, that is now the newest level of contempt. Mr. Speaker, I'm alive to the happenings of last evening where the CEO of Chief Shah was suspended, and the reasons given for it, Mr. Speaker, is professional misconduct. Mr. Speaker, I don't know whether there are any provisions in law for suspension of cabinet secretaries for either professional or political misconduct, but this one, Mr. Speaker, must go to the highest office in the land. When senators come to the chamber every Wednesday morning, the express reason for their appearance, Mr. Speaker, is to ask questions for and on behalf of the counties that they represent. And those questions are supposed to be responded to by cabinet secretaries. The Speaker is now becoming a trend. And I said this 2 weeks ago, that for 2 Wednesdays in a row, we were unable to transact the Wednesday morning sessions because cabinet secretaries are not available. We went on a break, Mr. Speaker. We have come back. The first Wednesday after the break, the cabinet secretaries don't show up. And what are we expected to do, Mr. Speaker? To just lament, express our displeasure, and wait for another Wednesday. Mr. Speaker, things must happen, and those things must begin to happen now. I was in this house, Mr. Speaker, and all of us were in this house a couple of weeks ago during the impeachment of the deputy president. And this house received a report that the deputy president then was indisposed. But in the wisdom of this house, Mr. Speaker, we continued with the process of impeachment. What avenue that do we have to continue with our sessions, with our interrogation, and especially in the midst of health, even in the face of reports that the CS is indisposed? The Speaker, I want to call upon ourselves, and I have heard Senator Chute saying that perhaps we need to bring a motion of censure against the cabinet secretaries. But Mr. Speaker, maybe that is not enough. Maybe, Mr. Speaker, the starting point would be to have a serious and candid conversation with the appointing authority of the CSs, so we get to know, the Speaker, whether these sessions make sense to government or maybe they don't make sense, Mr. Speaker. The reason for these sessions, Mr. Speaker, as I said, are for exclusively to have an engagement with cabinet secretaries for and on behalf of our constituents. If you look at the order paper, Mr. Speaker, for every Wednesday morning, there's no provision for another business. It's just questions to cabinet secretaries. If they cannot appear, Mr. Speaker, then perhaps we should even disband the Wednesday morning sittings. I speak for myself, and I speak for myself. This morning, I was supposed to be doing homework with my son. And I had to leave him and come to engage with the CSs. Now I've missed out on doing homework with my son, and I'm missing out on engagement with cabinet secretaries. For me, it's a wasted morning. And each senator here will have a story to say about what they were supposed to be doing. Now, Speaker, I think a time has come that really, and this is a bipartisan issue. This has got nothing to do with the political alignment of anyone. Now, Speaker, these cabinet secretaries, who are the face of the president, are giving this government a very bad name. That's what it is. Because, I mean, you cannot be invited to come to the Senate, and in the morning of the day that you're supposed to appear, you're writing a letter to the Speaker. Now, Speaker, if I were you, and I thank God that I'm not you, that's a letter that you just, RTS, just return to center. It's a letter that should not even be read before the Senate. It's contempt, Mr. Speaker. Mr. Speaker, with those remarks, I'm at a loss as to whether, Mr. Speaker, continue with these morning sessions on Wednesday, or free senators to engage in other activities which would also be more beneficial, perhaps to their families and to the people that they represent, than coming to sit here to wait for cabinet secretaries who have no respect at all to the Senate. The Speaker, I submit.
Senator Esther Okenyuri.
Thank you, Mr. Speaker, for this opportunity. I equally wish to join my colleague senators in expressing my displeasure in the failure by the cabinet secretaries to appear in this House, which has the mandate of the people. Mr. Speaker, this is one of the reasons I actually want to side with the president of being a lonely voice in government. The cabinet secretaries have chance to add voice to what government is doing in serving Kenyans. But you see, cabinet secretary tenders a very casual letter to members after very critical issues that we anticipated to be addressed this morning, Mr. Speaker. You can see the issue of polio vaccines, the allegations of children who have actually suffered adverse effects. I expected the Cabinet Secretary for Health to address and shed light on those matters. The issue of tuberculosis, the issue of HIV, those are very critical decisions we as a House ventilate on, question on, and get highlights on what government is doing. But it's really sad that when offered such a platform, a cabinet secretary tends to prioritize other matters other than life and death decisions which as a House have to make. Mr. Speaker, I want to say as a young legislator, it's very disheartening because these are people we actually want to lead by example, but this is what they are showing the young people and women of this country. Mr. Speaker, and very many other special interest groups that we represent. It's really sad, and I do not wish that members keep lamenting over this issue. There is a clear cut line on why Parliament acts as a separate arm. And I think cabinet secretaries need to prioritize the business of Parliament because Parliament has the mandate by the people. So this morning, I'm actually very disappointed that such heavy critical matters that were to be raised by different senators from these questions here are just going to pass by as time goes by and the clock is slowly ticking, Mr. Speaker. So this shouldn't be a joke like any other, Mr. Speaker. A serious discussion needs to happen around this because it's now become a norm that cabinet secretaries don't show up, time elapses before you even get a solution to what you raised. You've even lost, if it were patients, you've even lost them before they get redress on their matters. Thank you, Mr. Speaker.
Senator Maanzo Daniel.
Thank you, Mr. Speaker. Mr. Speaker, this morning we were ready to deal with the question of health. There are many, many issues. There are many questions relating to the Ministry of Health. There are many questions relating to SHA and SHIF. There are many questions relating to the 1998 American bombing victims, who we had earlier on asked the Ministry of Health to provide specialized medical health care to these particular persons. Just before I came to the House, I met a constituent of Makueni, who, shouted frantically at the gate that he needs help from me, that his child is stuck in hospital and he has been denied access because of SHA and SHIP, and yet he had paid. Mr. Speaker, these are the issues we wanted the Minister for Health to elaborate. Mr. Speaker, if we allow all cabinet secretaries to say that they have just gotten healed every morning of Wednesday, and no one ever comes to answer questions here, Mr. Speaker, the country will suffer. We all appreciate that one can get sick or fall ill anytime, although this House rejected the time of impeachment of DP Gachagua. It is something courts usually allow. But we want to say that it is important that we have quite a number of cabinet secretaries. Even if one is taken ill, the others should be able to appear, so that, and they know that on Wednesdays is our day with him, and even the cabinet and even their boss, the president, knows that we have set aside Wednesday for this. And that's why this particular day, there's never cabinet or an engagement with them, with the president, unless it is extremely urgent. And I believe cabinet secretaries should take Parliament serious. They are the image of the government. In this particular matter, they have failed the government terribly, and something must be done. Either one resigns if they are unable to handle the business as a cabinet secretary, or as a House, we take action, as Senator Chute has said, so that we can discuss the conduct of these particular cabinet secretaries. I thank you, Mr. Speaker. I'd beg to say that it is important that the cabinet takes this House seriously. I thank you.
Senator David Wakoli. Because, we might lament here the whole morning. So
Asante. Asante Mheshimiwa Spika kwa kunipa nafasi hii angalau taja machache kuhusiana na mchecheto mzima huu wa ukosefu wa mawaziri kuja hapa kujieleza kwa mapana na marefu. Mheshimiwa Spika, Biblia inasema Yesu alipokuwa anatembea na wafuasi, wakamuona mwanamke mmoja, wakamuita mzinzi, wakataka hata wampige mawe. Mheshimiwa Spika, na Yesu kwa busara yake akasema, nani miongoni mwenu hana dhambi? Yule asiye na dhambi atupe jiwe wa kwanza. Mheshimiwa Spika, wengi walifiata midomo, wakaweka mikia katikati ya miguu, Mheshimiwa Spika, na hatimaye wakamwacha binti huyu ambaye alikuwa anashiriki biashara zake. Kile ningependa kusema Mheshimiwa Spika ni kwamba hakuna mtu duniani humu hana dosari. Hakuna mtu duniani humu hana makosa. Kuteleza sio kuanguka. Na mimi naomba jumba la Senate kwamba tuna haki kikatiba kuwasikiza na wao kutupa majibu kuhusiana na changamoto zinazowakumba Wakenya. Ni dhahiri shahiri kwamba mfumo wa afya una changamoto. Tumeona viongozi wa wafanyikazi, madaktari wakitoa ilani. Yote tunakubali Mheshimiwa Spika, na sisi chote tunachotaraji ni kwamba waziri wa afya na yule mwenzake waweze kuja katika jumba la Senate, tujadili kwa pamoja na tutafute njia mbadala za kutatua changamoto hizi. Mheshimiwa Spika, waziri wa afya na mwenzake wako na nafasi kwa sababu ni wataalamu wa muda mrefu, wajieleze, watume arafa ama waje. Watueleze siku ambayo wamo tayari, wapo watakuwa tayari wiki lijalo Mheshimiwa Spika, ili kazi ambayo tunayo katika jumba la Senate iweze kusonga kwa kasi. Sasa mimi sitaki kuwa yule mfuasi wa kutupa mawe katika kundi la wale wa Kristo waliotaka uponyaji, lakini ni kuomba Senate iwape nafasi, iwapo ni wiki lijalo waje wajieleze kinagaubaga, tufunge ukurasa wa changamoto hizi na tusonge mbele, Mheshimiwa Spika. Na mwisho, hawa ni mawaziri ambao ni wapya, ni ufagio ambao lazima uanze kufagia na kutengeneza serikali. Sasa tuwape nafasi, japo tuna hasira za mkizi ni furaha kwa mvuvi, Mheshimiwa Spika, na sisi sio wavuvi, Mheshimiwa Spika. Sisi ni jumba la Senate ambalo tunawapenda wote, na tuwape wote nafasi kufanya kazi kwa mujibu wa katiba na yale yanayoweza kufanyika kibinadamu. Asante, Mheshimiwa Spika.
Senator Mudigi Alexander.
Asante Bwana Spika. Mimi niko na huzuni mkubwa kwa sababu siku ya leo, wakati tulisema mawaziri watakuwa nakuja siku ya Jumatano, tulikuwa tuko na mahono ya kusaidia mwananchi katika mashinani, Bwana Spika, kwa sababu tukiwa maseneta sisi huwa tunatetea ukatuzi, na ukatuzi hawa mawaziri wanafanya kazi katika mashinani ndio mwananchi aweze kufaidika. Na niko na huzuni pia kama sisi maseneta tunaweza kuja hapa na mambo ya ukoo ama mtu ni wa ukoo gani, alafu tunaanza kutetea, kwa sababu najua wakati Bwana Spika wale tulitimua na tukaleta wengine wapya wamekuja na ujuzi ya kufanya kazi, kwa sababu Bwana Spika, wakati mtu amechaguliwa anafaa kujua siku hiyo anafaa anje kazi. Ni kama vile Yesu alikuwa anateua watu na watu wafanya kazi kutoka siku hiyo. Tuko na mfano Bwana Spika, wakati deputy mteule ambaye Abraham Kindiki Kithure alichaguliwa, alianja kazi mara moja. Sasa nimeshindwa kama nimeona senator mwenzangu, kwa sababu mtu ni wa kabila yake anakuja kumtetea. Ukatusi tutaiua, kwa sababu niko na huzuni katika Embu County. Waziri ambaye ni wanyama wa pori, ambaye siku ya leo wiki hii Bwana Spika, wiki hii unakuta Kiambere Ward kuna kijana mmoja ameuawa na ndovu, na saa hii watu familia yao hawana chochote na kuwa wanachanga. Kwa hiyo niko na huzuni. Bwana Spika, nataka unipe nafasi niweze kuongea, kwa sababu wana wakoli rafiki yangu ameongea kamaliza. Niko na huzuni, nataka nisaidiwe, kwa sababu mtu anaitwa John Muturi Mugo Kiambere Ward ambaye ameuawa na ndovu jana, na leo mvua inanyesha, na huyo waziri wanyama pori angekuwa hapa. Pia niko na huzuni, jana usiku mambo ya SHA na National Insurance Fund kuko na vita, unakuta kuna mtu ametimuliwa na watu wanakufa, wengine wanagonjeka, alafu sasa mambo mengine yafanyika. Kwa hivyo Bwana Spika, mimi nakataa mambo ya wale maseneta wanapinga. Ningetaka watu washukuriwe hatua ambaye ni kali, kwa sababu tuko na njia ya kufuata katiba ya serikali ya muungano. Asante Bwana Spika.
You should also give him that opportunity, because I'm the one controlling the house. There was a point of order which was persistently requested by Senator Wakoli, and you did not give him that opportunity when you were on the floor. So now, because he is not on the floor, it is not possible to give you the point of order. Yes, 1 minute.
Honorable Speaker, it is out of order, utter discontent and misuse of power for a colleague to rise on the floor of this house, cast aspersions that whenever we stand on the floor of this house, we are talking on tribal basis. Honorable Speaker, I respect Dr. Mundigi, but he's assuming and pushing away the title doctor and remaining with the Mundigi alone, Honorable Speaker. He needs to withdraw that statement and talk like a doctor, Honorable Speaker. Thank you.
Mundigi, because you did not even mention what he said, that you feel it is out of order.
Is it in order to allege that I'm talking based on tribal lines? I'm an Honorable Speaker, speaking out of cognizance of pedagogy, Honorable Speaker.
Senator Mundigi, can you clarify that issue raised by
Asante Bwana Speaker, sikuwe na umbaya yote na viki yangu ambaye ni wakoli senator ambaye kutoka kule upande wa Bungoma, ni rafiki wangu ni kuwa sikuwa na maneno yoyote. Mimi naunga wasiri wote mkono wale walichaguliwa. Ni vile niko na shinda kwa sababu ile mambo yanaendelea, mambo ya SHA, na nikashindwa kwa nini wasiri anja kuja. Na pia umesikia hapa nikiongea kule Kiambere mtu aitwa John Muturi ambaye Mugo ni kitu ambaye imefanya niwe na njia ya kuwa mwili yangu haisikii vizuri. Kwa hivyo ningeomba hiyo mambo nimeongea nisamewa, lakini Bwana Speaker, next time wasiri wakiwa tumewatimua, kwa sababu umeona hata Dr. Karwale ametoka hapa, na fikiri hiyo ndio kitu imefanya atoke katika hapa, na tunajua watu wasiri wengine walikuja hapa unakuta wanatetemeka. Bwana Speaker, siko na mbaya. Bwana Speaker,
asante na pole kwa kuumwa. Senator Kavidu Agnes.
Thank you, Mr. Speaker, for giving me this opportunity. It's really sad for us to be here every Wednesday morning and we don't see any CS coming to answer the questions. Mr. Speaker, it is important for these CSs to know that we have cancelled all other businesses for this house in the morning Wednesdays. Even committee meetings does not meet because of giving this questioning time first priority, because we need to question them about the issues that they should be doing. Mr. Speaker, I am here this morning because of the 1998 bomb blast. These people are really suffering without even care from our government. And this morning I was ready to face the CS and let her or him explain why these people cannot get medication. Mr. Speaker, we are facing a lot of trouble at our counties, especially Machakos County, because when people go to hospital, instead of the SHA putting up the bills, Mr. Speaker, SHA is not in operation and people have paid and they cannot be discharged from hospitals. They keep on calling us for bills and we keep on making phone calls to NHIF to know what is happening. Mr. Speaker, this is wrong, and CS for health must appear before this Senate to answer questions. Even if she's unwell, she has an assistant or the PS at the ministry. They should appear. Mr. Speaker, it is not right for us to waste our time to come here every Wednesday and we find there is no work we are coming here to do. Thank you, Mr. Speaker.
Senator Kavidu, you know our standing order does not provide appearance by any other person except the CS. So the PS is not admissible in the Senate. Maybe you will check standing order 51C. They will guide you who should appear. Only the CS should appear before the Senate. Anyway, we get next Senator Sigei Wakiri Hilali.
Thank you, Mr. Speaker. This House stands in a very high status under the Constitution, and the mandate of summoning the Cabinet Secretaries for purposes of responses to questions by honorable members is a very, very important role that, as we have previously stated in the House, the Cabinet Secretaries, who at any given time are required to appear, have appropriate notice, and the questions they are supposed to come and answer already availed to them in good time. For the honorable CSs not to appear this morning, Mr. Speaker, some of them with very flimsy reasons is an utter disrespect of the House. And being a member of the House that has come in this morning to ask questions regarding not only the interest of the people whom I in particular represent, but for the entire country, it is very unfortunate that we do not have them appearing in the House. At the risk, Mr. Speaker, of being creating an extension of the lamentations that you previously had, I have looked at the two letters from the two CSs. One, Mr. Speaker, which has been received after the House started from the CS of Health has got an explanation that the Cabinet Secretary is indisposed. This, Mr. Speaker, from the previous resolutions of this House, do not stand the reasons why a Cabinet Secretary is unable to appear before the House. Number two, Mr. Speaker, we had yesterday in the SBC not received this letter. The standing orders of this House, which applies to all who are required to appear, requires them to have submitted any excuse or letter in good time to justify their non-appearance. This is a fly and an utter disrespect in the House for the CS to write and say she's merely indisposed. I would want to agree with the Honorable Senator Chute and the rest of my colleagues who have said that it is high time we censor these cabinet secretaries who have shown disrespect to the House. We have a right to discuss their conduct and censor them, Mr. Speaker, because if they are unable to appear before the House and for no reason at all that is justifiable, then they have no business being holders of such high offices. The other one, Mr. Speaker, which is one of the reasons why we also should call them out, is a letter received yesterday, which the House Business Committee rejected, by the Honorable CS for, this is what the CS said in the letter, that, Mr. Speaker, today they were to attend to a prior scheduled ministerial event on black rhino ear notching and fitting of monitoring devices. This is something that a cabinet secretary can delegate to a person of the lowest rank in that particular ministry. It cannot be a reason for a CS to say he is abandoning a responsibility to appear before the House to go and fit in monitoring devices to a rhino in the national park. Mr. Speaker, this is the sort of behavior that we have said before, that these people, the moment they get into office, they forget that they are holding such offices for the interest of the Kenyans. And the best interest of Kenyans can only be served by appearing before this House to answer questions of national importance that represent the people who are represented by the senators in this particular House. This particular letter, Mr. Speaker, was rejected, and the CS was asked to appear. We have not received any response to the letter that had indicated to him or her that we are not buying the excuse. And, Mr. Speaker, it is high time that, as I've said, we censor these cabinet secretaries for them to appreciate the importance of appearing before the Senate, because if they take the House the way they do with disrespect, they definitely cannot take their responsibility as cabinet secretaries as serious as it should be. And we've got so many Kenyans who are capable, willing, and ready to serve in such offices. So, Mr. Speaker, even as we regret the time that we have wasted this morning, we also call upon the authorities relevant to call upon these irresponsible CSs to appear before the House. We are struggling right now with the issue with regards to the health sector, the chief and SHA, Mr. Speaker. This would have been a very important opportunity for the Cabinet Secretary for Health to explain to the Kenyans the situation as is. Yesterday we had, and we saw the national news carrying a position taken to suspend the CEO of SHA, and it is a time that Kenyans need to understand the things or the positions or options the government is taking in order to make sure that they streamline the representations that we have in the Ministry of Health. And if the Cabinet Secretary can just wake up in the morning and say, I'm indisposed, I therefore cannot appear before the Senate, Mr. Speaker, we don't buy it, we do not accept it, it's not acceptable, and we are calling them out because they are failing Kenyans, they are failing the government that is highly expected to perform and support the programs that help the people of Kenya. Mr. Speaker, it is not acceptable at all, and we do not, as a House, condone such kind of a character, and behavior by the Cabinet Secretary. Mr. Speaker, I join my colleagues in calling them out and say this is improper, and I thank you.
Honorable Senators, the time we had set for these interventions is almost over. So maybe if you give you time, just take 2 minutes, kindly. The whole country has earned the Senate this morning. Therefore, maybe if we even conclude this discussion, the better. I want to give one of the senators when the question with the Minister of On Drive, Senator Rachel Julius Mulgo.
Thank you very much, Honorable Speaker, for giving me the opportunity to also add my displeasure about the behavior of our Cabinet Secretaries. This, Mr. Speaker, actually shows the attitude that our CSs have towards the Senate, and it seems like they have no regard for Senate, and they probably do not have a clue what this House stands for and what the members represent. And therefore, that translates into even them not prioritizing the situation and the plight of the citizens that these members represent. And so when our citizens and the citizens of Kenya bring their situations and pressures and plights in hospitals and so on to us, these people have no interest in attending and prioritizing the situation of health, the situation of those that are killed by elephants, and many others. And therefore, their priorities are not Kenyan, their priorities are not in agreement with what members in this House are looking at as being concerns of Kenyans. And so action that is of the highest level needs to be taken so that a lesson is learned, and therefore bringing awareness and awakening status to the cabinet secretaries. And therefore, I agree with one member that said that we should take our
It's because we said 2 minutes so that we conclude this discussion. Senator Ogola Beatrice.
Thank you, Honorable Speaker. Honorable Speaker, this morning I was happy coming to share with the CS Health, especially coming from recess, and we've been sharing with the members of our communities. We have a lot of issues that are affecting health, which we needed the CS to clear. This morning I was coming to stand in for Senator Tobiko, Perez Tobiko, and Senator Catherine Muma, and especially to get clearance on the Linda Mama initiative, which sought to achieve universal health access to maternal child health services. Honorable Speaker, we all know my interest on maternal issues, and so I missed this opportunity, but I hope the CS is going to get well and come to the Senate so that we are able to sort a number of these issues. Honorable Speaker, people do not decide when they fall sick. And so, I'm happy at least the CS did a letter. A number of my colleagues have compared it to the impeachment process we had with the Deputy President. Honorable Speaker, I remember the Senate took its time and adjourned at the request of Senior Counsel Paul Muite when he indicated the former Deputy President was sick, and we took a break. When we came back, the Senior Counsel also requested that we break up to 5, and the Senate was able to break. That was That was a demonstration that we were also appreciating that people do not choose when to get sick. But we had a constitutional time frame to observe, and so we went ahead. But it showed we respected the right of the Deputy President then, and so, Honorable Speaker, when the CS gets well, we welcome her to the Senate to share on the...
Senator Murango James.
Asante sana Mstahiki Speaker. Ya kwanza ninataka niseme ya kwamba kufika hapa asubuhi, mimi nimetoka nyumbani saa 10 ya usiku, ili tuweze kuongea na kujadiliana kuhusu mengi sana sana, kwa sababu Wizara ya Afya ni muhimu sana katika Kenya hii. Mstahiki Speaker, unaweza jenga barabara, unaweza fanya mambo mingi, lakini huwezi fanya kama watu wamekufa. Wanaotumia hizo huduma ni watu walio hai. Kwa hivyo kitu ya kwanza pia nitamwombea Daktari Barasa uponyaji wa haraka ili aweze kuja kujibu maswali. Lakini pia kwa sababu ni daktari, Waswahili husema kiserema hulima kuliko njembe mpya. Yeye ni daktari. Na kwa hivyo wakiwa ni mzoefu wa mambo ya hospitali, pia majibu ambayo tumepata saa hii ingekuwa pia iwe ni majibu ambayo inajibu maswali yote yaliyoulizwa. Lakini ya kushangaza sana ni waziri ambayo anahusika na wanyama pori, Aden Duale, ambaye amekuwa kiongozi wa wengi katika bunge la kitaifa. Lakini leo
maana sio Aden Duale, ni
Rebecca Miano.
Rebecca Miano.
Oh, pole, samahani.
Aden Duale ni waziri wa mazingira na misitu.
Nadhani hiyo nimekuwa nimepewa taarifa mbaya hapa na rafiki yangu hapa. Sasa Mstahiki Speaker, nasema ya kwamba Rebecca Miano hakuwa mgonjwa, lakini ameamua kwenda kuweka vifaru kengere katika hifadhi ya wanyamapori. Hiyo ni kusema ukiangalia katika taratibu ya venye wanaumbeba na uzito, anatuchukulia kwa urahisi kama bei ya chumvi. Ni kusema vifaru kwanza, seneti ndio tunafuata. Kwa nini hangetuma mtu kwenda kuweka hizo kengere? Kwa sababu niko na uhakika sio yeye anaweka vifaru kengere, hapa vifaa vya kuweza kufuata vifaru. Lakini pia nasema kwamba tumepoteza nafasi farau ya kuelezea mambo inayoendelea katika serikali. Na Waswahili husema ukikalia kutikavu kuanguka si anjali. Na
Nilikuwa napendelea misamiati yako, lakini muda umetukataa ndugu yangu. Wacha tukuongeze dakika moja na utumie vizuri kuleta misamiati mingi.
Kusiwe na mazoea ya mawaziri wakiitwa hawaji. Hao Waswahili, kwa sababu niambiwa niseme ingine, wanasema ya kwamba kuti la mazoea kumwangusha mgema. Huku kukosa kwao utakuja kuangusha wa mawaziri. Asante sana Mstahiki Speaker.
Senator wa Matinga Wahome.
Thank you very much, Mr. Speaker. Sir, I also like to express my displeasure with the conduct of some of the CSs. But having said that, Mr. Speaker, sir, I would also want to wish Dr. Barasa quick recovery. Having said that, I think on average we've been doing quite well. Maybe what we also need to do is to look at the time that we spend with the ministers, both in the House and in the committees, Mr. Speaker. Some of the questions that we put through to the CSs, they are raised in the committees, and maybe we need to also look at their schedules so that this appearance and non-appearance, when we come here on Wednesdays, expecting to get answers, Mr. Speaker, only to find that a CS has been committed elsewhere, then it means that there is a kind of a disconnect between the way we work and the way the executive works. It's the high time that we brought this in tandem. Most importantly, knowing that what informed this Wednesday session is so that we can create a kind of an interactive moment where we are able to go and tell our constituents, the people we represent, this is what the government is doing. And indeed, I also want to agree with the fellow senators that when the president expressed his displeasure that he's working alone, I really can pity him, because if the CSs do not pull up their socks, Mr. Speaker, then in the next couple of years, we'll all be sent home. And Mr. Speaker, as we prepare ourselves to deliver to Kenyans, we must recommit ourselves, starting from the executive, the legislature, and the judiciary, to serve the people of Kenya, and knowing that we prioritize the business of the people of Kenya, and most importantly, that our appearance and telling them what we are doing and when we want to do it and how we are doing it, it's paramount so that the people can understand that we are committed to serving them. Mr. Speaker, sir, I also express my displeasure and wish that we will change the engagement moving forward. Thank you, Mr. Speaker.
Senator Mandago Jackson.
Thank you, Honorable Speaker, for the opportunity you've given me. First, to register that, Honorable Speaker, we have regulations and rules on how to handle cabinet secretaries who don't appear for a session. So I would request that first the Senate issue summons to those cabinet secretaries, Honorable Speaker, so that we are sure in the next session they should be able to attend the Senate and answer to a few questions. Honorable Speaker, particularly on matters of health, there are a number of concerns, and you know my committee, Honorable Speaker, has a lot of statement from all these honorable members on the implementation and the rollout of SHA. These opportunities CSS are being given is a good opportunity to ventilate on the issues and also speak to the nation about some of the challenges and the issues that have been raised by citizens from across Kenya. And this is a good platform for the CSS to actually explain to the nation how they are handling some of those challenges. I would therefore want to ask that, Honorable Speaker, Cabinet Secretaries do take the matters of the Senate and the House and Parliament seriously, Honorable Speaker. And Honorable Speaker, there seem to be a culture brewing in the executive, particularly in the Cabinet Secretaries and PSS, of contempt on elected leaders, Honorable Speaker. I think it is time they realize that we equally have a mandate to represent the people who have elected us, just the way they have a mandate that have been given in the executive to implement. And working together, we can achieve more and better results than working at cross purposes, Honorable Speaker. I submit.
Senator William Kisan.
Thank you, Honorable Speaker. I also add my displeasure to the absence of the CSS. If you remember, Mr. Speaker, it is the executive that requested that they come to the House to answer questions. It was not Parliament that initiated this particular issue, it was themselves. So you can imagine a CS Miano, deciding to go and witness putting devices in rhinos instead of sending the Director General for KWS basically, or the PS. It's a contempt of the highest order, Honorable Speaker. She needs to be censored or even impeached because she's terrible. Second, Honorable Speaker, the CSL, we wish her a quick recovery. And I was telling my colleague here, we hope that in the evening when we watch news, we are not going to see her in the news talking about SHA and she's saying she's indisposed, because that will be a serious contempt, Honorable Speaker, because Kenyans are crying about SHA. People are not getting medical attention by especially public hospitals, Honorable Speaker, and the ministry is in the habit of going around and lying to Kenyans that things are working. They are not working, Honorable Speaker. That is why she had called an opportunity today to come and tell Kenyans what is ailing the implementation of SHA, because basically there was nothing much that NHIF, they didn't have a lot of issues. They should have just maybe done reorganization of NHIF so that Kenyans can continue receiving medical cover as they used to get. The question by senators, there is Edu, Avia, we have Linda Mama, and they are not accessing as we speak of now. So she needs, as soon as she recovers, she needs to come here at the earliest opportunity to come and answer to Kenyans, Honorable Speaker.
Senator Corili Beatrice, Joyce.
Yeah, thank you very much, Honorable Speaker. I want also to register my great regrets on the absence of the the ministers who were supposed to appear before this House this morning. Honorable Speaker, this is a House of procedures. This is a House of rules. And I wonder, Honorable Speaker, when we are ready with the questions, which have been set not yesterday, but some within the prescribed time frame. And towards the last minute, we are told that the relevant the CSS are not able to attend. Honorable Speaker, I think it's high time this House sets on the time frame in terms of response on when the relevant CCs are supposed to respond to the House, whether they are coming or not. Because, Honorable Speaker, all of us have come this morning ready with a number of questions that are running across the minds of several Kenyans because, Honorable Speaker, health is a serious issue. You remember right now in the social media, there is a child who lost a life in Bomet due to negligence. Honorable Speaker, these are issues that are affecting us in the health sector. Honorable Speaker, I want to say that I think it's enough that we should not be taking a lot of time, the whole morning, discussing the absence of the CSS instead of handling issues that are affecting the Kenyans. So it's high time that we need to change this. We need to set rules because this is out of procedure. Say that we cannot be here deliberating on a number of CSS who will be missing. Not only, this is not the first day. I think it's now becoming a norm. So, Honorable Speaker, we need to handle this with a lot of concern so that we cannot be wasting time coming this morning.
Senator Mazayo Stewart.
Asante Bwana Spika. Bwana Spika, ni jambo la kusikitisha kuona ya kwamba kila uchao tukiweza kuwaita mawaziri ambao wanatakana kuja kujulisha wananchi katika Kenya na kujibu maswali ambayo yana umuhimu katika taifa la Kenya, hususan upande wa afya. Tunaona ya kwamba kumekuwa na upotevu wa kuja katika bunge la Senate kuweza kueleza wa Kenya ni shida iko namna gani. Tukisema namna hiyo Bwana Spika, tunaona kwamba mara nyingi kumekuwa na vifo vya wagonjwa, kumekuwa na ukosefu wa ile insurance wanaosema wananchi wanapata na wakifika hospitali wanaregeshwa. Ni muhimu ikiwa hawa mawaziri wanaweza kujitokeza na kuweza kujibu haya maswali. Bwana Spika, la mwisho ni kwamba itakuwa jambo la aibu na jambo la kusikitisha ya kwamba ikiwa mtu ameitwa kuja, ikiwa waziri ameitwa kuja kujibu maswali ndani ya bunge la Senate na akikosa kuja, ni uvunjaji na ukiukaji wa sheria, na bunge hili linaweza kuchukua hatua ya kuweza kumpatia summons kama zile za kule kotini, kuona ya kwamba amefika hapa, na akikosa kuja tena tunaweza kumpatia, anaweza kupigwa fine ya kwamba hili bunge lina uwezo wa kuweza kupitia fine. Bwana Spika, anasema kuna umuhimu wa sisi kupeleka message ngumu zaidi ama ya uzito zaidi kuona kwamba hawa wamekamilisha agizo la hii bunge la Senate. Asante Bwana Spika.
Senator Boy Isa Juma.
Asante sana Mheshimiwa Spika, pia ningependa kukemea sana kwa sababu Mheshimiwa Spika, sahihi haswa kama kule katika kaunti ya Kwale nilikuwa nimejiandaa sana siku ya leo kuja niweze kumuuliza maswali huyu waziri wa afya. Mheshimiwa Spika, kuna wagonjwa wengi sana ambao katika referral hospital ya Msambweni wiki ile iliyopita mimi mwenyewe nilienda, mimi mwenyewe nikashuhudia wagonjwa kirudishwa kwa sababu ya hii mambo ya SHA. Mheshimiwa Spika, sisi kama Wakenya tutakuwa uhuru au tutajivunia afya mpaka lini? Hata waheshimiwa wenzangu leo wengi sana walikuwa wamejiandaa kwa sababu kama kila kaunti katika 47 kaunti zetu shida kubwa sahihi ni hiyo mambo ya insurance ya SHA. Mheshimiwa Spika, mimi nakemea sana. Kama waziri alikuwa anajua kwamba ni mgonjwa toka Jumatatu au Jumanne, angetuma salamu mapema, lakini salamu zimekuja tu jana, sijui leo watu wamejiandaa kuuliza kupata mwafaka kwa nini hii SHA inaleta shida katika kaunti zetu. Mheshimiwa Spika, mimi kama seneta wa Kwale nakemea sana. Siku nyingine huyo waziri aje mwenyewe personal, kama hawezi atuambie mapema siku fulani mimi nitakuja. Kwa hivyo Mheshimiwa Spika, nakemea sana huyu waziri arekebishe hii tabia yake, sio kutuma barua dakika mwisho akikimbia alafu kesho tunamuona katika runinga yuko Samburu. Tabia mbaya sana Mheshimiwa Spika. Akome tabia kama hiyo. Watu wa Kwale wanasema tunataka hii SHA ifanye kazi kwa haraka sana. Asante Mheshimiwa Spika.
Mwisho Senator Mwaluma Jones.
Asante Mheshimiwa Spika kwa hii fursa umenipa. Mheshimiwa Spika, tulipoanza huu muhula wa Senate tulibadilisha kanuni. Tukasema siku ya Wednesdays kuwe na mawaziri wanakuja ili kujibu maswali ya maseneta. Nafikiri kama mawaziri wanaona hawawezi, ama tuseme watendakazi executive wanaona kwamba hawawezi kuja hii siku kujibu maswali, basi tubadilishe kanuni, kwa sababu Mheshimiwa Spika, kuna kazi nyingi sana za kufanya. Kuna maswali mengi ya kamati ambayo hayajajibiwa, mengine yamemaliza mwaka. Maswali ya mashamba, maswali ya tourism, mambo ya kupigana kati ya wanyama pori na wananchi. So kuna maswali mengi na maswala mengi ambayo tungekuwa tunayafanya katika kamati siku kama ya leo, Mheshimiwa Spika. Kwa hivyo kama mawaziri wanaona hawawezi kuja, ni vizuri Mheshimiwa Spika tuangalie ili tubadilishe kanuni ama standing orders ili tupate Wednesday kama siku ya kuita mawaziri na kamati zetu kufanya kazi kawaida, ili tuendelee kutunga sheria na kufanya kazi zinginezo, Mheshimiwa Spika. Otherwise hii SHA haifanyi kazi, huduma za afya zimedorora, haieleweki nafanya kazi vipi, wananchi wetu wanateseka. Kwa hivyo pia nakashi kwa kinywa kipana kutokuja kwa waziri wa afya katika hili bunge. Asante Mheshimiwa Spika.
So, honorable senators, in accordance with the standing order 45.2, I want to reorganize this business. The order appearing as number 8, 9, 10, and 11 are deferred till the next time. And therefore, honorable senators, there being no other business on the order paper, the Senate stands adjourned until today, Wednesday, 13th November 2024 at 2:30 p.m.